Namaste to everyone. Hi, this is Praveen here. Today I am going to talk on the dengue fever. What is dengue fever? It's a self-limiting mosquito-transmitted acute disease. Self-limiting means there is no medication for it. It comes, it stays in the body for some times, and it goes by itself within 3 to 10 days. So that is a self-limiting. It is a mosquito-transmitted. It comes through the mosquito, particularly Aedes aegypti female mosquito. Is an acute disease. It's not a chronic illness, so it stays in the body for only for the duration of 3 to 10 days. So that is the acute disease. It is characterized by the fever, headache, muscle pain and joint pain, rashes, nausea and vomiting. It's caused by the virus called arbovirus and spread by the Aedes group of mosquitoes, commonly Aedes aegypti. In India, the first dengue fever reported during 1956 from the Vellore district of Tamil Nadu. We can find all the serotypes. There are four variants of serotypes of dengue, that is DN1, 2, 3, 4. DN1, DN2, DN3, DN4. We can find all these four variants in India, commonly DN1 and DN2. The size of the virus is about 50 nanometer and is a single stranded RNA. DN1 to 4 are antigenically similar, serotypically different. Infection with any one serotypes confers the lifelong immunity to the virus serotype. So if the person get DN1, he'll become immune for DN1 lifelong. If he get DN2, then he become immune for serotype DN2. It means if the person get DN1, he won't get the infection with the DN1 in the future. He may get the DN2. So first time when he get the infection, usually the patient land up with the dengue fever and he is immune to that DN1. There is a chances of getting the DN2, DN3, DN4. When these different serotypes infect the person, then if the second time, so if the second time infection are more prone for the dengue shock syndrome and dengue hemorrhagic fever. Whenever the person get infection first time, that is dengue fever. Second time infection, he is more prone for the dengue hemorrhagic fever and dengue shock syndrome. This is transmitted from the female Aedes mosquito. So for the egg yielding, it requires blood. The only female mosquito bite the human. Male mosquitoes get their food from the plant. Hence, the female Aedes mosquito is the transmitter. This is called a primary vector, Aedes aegypti. Some other Aedes group of mosquito also can transmit this. Those are Aedes albopictus, Aedes polynensis, Aedes navius. These are called as secondary vectors. Aedes aegypti completes its aquatic stage within 7 days. That means it takes 7 days to become egg to mosquito. Eggs can survive 1 year without water. This we have to remember. That's why when the raining start, so sudden there is an increase in the count of the mosquitoes because egg are ailed by the mosquito somewhere else, but because of the unfavorable atmosphere which has not turned into the mosquito, but these eggs can survive in that places for 1 year, and whenever these eggs get a favorable atmosphere with the water and all, so these can become mosquito within 7 days. The average adult survival, the mosquito will survive as an adult for 15 days. So these are more potentially vectors. At this stage, this becomes a vector for the transmission of dengue fever. It best survives between the 16 to 39 degrees Celsius. These will survive in the areas where the water is easily available. For example, overhead tanks, groundwater storage, unused tires, flower pots, desert coolers, tree holes, etc. Wherever a small amount of water can stay or the large amount of water can stay, these are the areas where mosquito can grow easily. Transovariant transmission. The virus transmits from the infected mosquito to the next generation through eggs. Incubation period is 8 to 10 days. So once the person will get infected with the dengue virus, he may present with the symptoms after 8 to 10 days. Clinical diagnosis of the dengue fever, dengue hemorrhagic fever, and dengue shock syndrome. The first infection in the non-immune person usually causes dengue fever. This we have to remember. So first infection. Till now, the person is not at all infected with the arbovirus. This is the first time he is getting infection. So he usually present with the dengue fever. The subsequent infection by the different serotypes causes DHF or dengue shock syndrome, dengue hemorrhagic fever or dengue shock syndrome. This is a subsequent. If in the later period of his life, after 3 years, 4 years, if he get infection with the different serotypes, usually if the person get the DN2, so he'll become immune for the DN2, but he may get the infection with the DN3, DN1 or DN4. So these subsequent infection may cause dengue hemorrhagic fever or dengue shock syndrome. Coming to the pathophysiology, it can be understood in the two forms, that is the production of antibodies and activation of T cells. So when the antibodies are produced, then the antigen antibody reaction takes place with the complement activation, which leads into deposition on the vessels. If antigens get deposited on the vessels, then it causes the vasodilatation on the various tissue. There is the inflammation of the various tissues, and platelet, if it is get deposited on the platelet, then it causes platelet dysfunction that leads into clinical manifestations. Activation of T cells produces of various cytokines. These cytokines causes the increased permeability of the vessels that leads into plasma leakage and presenting into the ascites or the pleural effusion, etc. So leads into clinical manifestations. Clinical diagnosis of dengue fever. Febrile illness lasts for 2 to 7 days, and along with this febrile illness, the more of 2 or more manifestations like headache, retroorbital pain, myalgia, arthralgia, rash, hemorrhagic manifestations will be there. So along with fever, any 2 or more of these, that is headache, retroorbital pain, myalgia, arthralgia, rash, hemorrhagic manifestations, if these symptoms are present, then we can suspect of dengue fever. Hemorrhagic fever, along with the features of dengue fever, if we get a positive tourniquet test, that is nothing but the tourniquet test is performed by inflating the blood pressure cuff to the midpoint between the systolic and diastolic pressure for 5 minutes. The test is considered positive when 10 or more petechiae per 2.5 square centimeter are observed. Or else we can see the petechiae ecchymosis purpura, bleeding from the mucosa like gums, conjunctiva, etc. GI tract, that is like either vomiting or passing the stool, so hematemesis, or else the melena. Injection site, wherever the IM injections are given, that start oozing the blood, or some other sites also. Any kind of bleeding is with the dengue fever features, they are suspected as the dengue hemorrhagic fever. And thrombocytopenia, decreased platelet count, that is less than 1 lakh cells per cubic mm. So normal count is 1.5 lakh cells per cubic mm, and evidence of plasma leakage. So as we know, in the vessels, blood corpuscles will be there like RBC, WBC, platelet, and rest of the things is plasma. So because of increased vascular permeability, this plasma leaks into the third space, leads into pleural effusion or ascites, or intercellular space also leads into hypertension, which leads into hemoconcentration. The blood, because there is a disparity between the concentration of the plasma and the corpuscles, hence the hemoconcentration will be the result of this plasma leakage, and end up with the increased or rise in the average hematocrit. Hematocrit is the investigation seen in the CBC, that is complete blood count. The hematocrit will increase, that indicate the hemoconcentration. In case of dengue shock syndrome, along with the dengue hemorrhagic fever, there will be hypotension, decreased blood pressure, and cold clammy skin or restlessness. These are the clinical features of dengue shock syndrome. Coming to the investigation, there are so many investigations to identify the dengue fever, that complement fixation test, neutralization test, uh, hemagglutination inhibition test, isolation of the dengue virus. There are so many investigations, but these are the commonly used investigations, that is the NS1, IgM, and IgG. NS1, that is non-structural 1 protein, which is secreted by the infected cells, that is dengue virus infected cells. It's an indirect method to say that the person is having dengue fever. If the person get the infection with the dengue fever, that is arbovirus, this arbovirus infected cells will secrete a protein called non-structural 1 protein. If this is identified, which is indicate there is a presence of dengue fever. This NS1 may be present, or this non-structural 1 protein get secreted by the some other infections also, like in case of leptospirosis and all. IgM indicate a primary infection, that is a recent infection, commonly seen after the fifth day. This IgM is commonly seen in the investigation after the fifth day, but there are some cases there on the second and fourth day also we can get the IgM positive, and some other in others it may not develop after the eighth day also, and it will get washed out from the body after 90 days, that is after 3 months. IgG, if the IgG appears, it indicate a previously the person has suffered with the dengue. It appears after 14th day and it persists for lifelong. Assume if the NS1 IgM comes positive and IgG is negative, it indicates recent infection. If the NS1 is positive, IgM is positive, IgG is also positive, then it indicate a this secondary different serotype infection. The person, if the IgG comes positive, means if the person is already infected with the dengue previously, and NS1 also is present, hence it is a infection of a dengue fever, second time of infection or third time of infection of the dengue fever with the different serotypes. So these kind of people are prone to land up with a dengue hemorrhagic fever or dengue shock syndrome. Management of dengue fever: bed rest, cold sponging to keep the temperature below 39 degrees Celsius, and paracetamol has to be given at the rate of 10 to 15 mg per kg, at the dose of 10 to 15 mg per kg at the interval of 6 to 8 hours as requirement. For adult, 500 mg, and avoid the ibuprofen, diclofenac, aspirin, which causes the platelet dysfunction. In excessive sweating and vomiting, the electrolyte therapy may be required. The patient may require hospitalization. In dengue hemorrhagic fever, the febrile illness has to be managed as that of the dengue fever. The critical period is the transition from the febrile to afebrile stage. This is the critical period, because this is the time where there is a sudden or drastic decrease of platelet will take place. Hence, it is a critical period. The person turning into feverish to non-feverish. So, this is the critical period. So, this once the patient become afebrile, so his platelet has to be monitored every 12th hourly for the duration of 48 to 72 hours. For 2 to 3 days, there is a chances of drastic decrease in the platelet count. Serial hematocrit determination is essential to rule out the plasma leakage, so whether the patient is moving into shock syndrome or what. Hematocrit, because you see, when there is a plasma leaks more, then the hemo concentration takes place and hematocrit will increase. In case of bleeding tendency and thrombocytopenia or dengue shock syndrome, you have to initiate the IV therapy, 6 ml per kg per hour crystalloid solution, that is the isotonic solution, for 1 to 2 hours. If there is improvement, then you have to reduce from 6 ml to 3 ml per kg hour. And if the patient improved, there is no deterioration, then IV fluid has to be stopped after 24 hours. If there is no improvement here, then you have to increase the IV fluid rate from 6 ml to 10 ml, and it has to be continued for 2 hours. If there is improvement, then you have to reduce and stop. If there is no improvement, then assess the hematocrit, hemo concentration. If there is a hemo concentration, then replace with the, rather than a crystalloid, we are stopping now crystalloid and move into the colloid. That is dextran 40. There is no, if there is the hematocrit falls because of the excessive crystalloid solution, then the blood transfusion has to be planned at the rate of 10 ml per kg per hour. Criteria to discharge the patient. This is about the management of the dengue hemorrhagic fever. Dengue shock syndrome has to be managed with the inotropics. Sometimes it requires inotropics, and inotropics initiated based on the urine output, and sometimes patient may require bronchodilatations if there is a pleural effusion and all, nebulization, etc. So the systemic hypertension has to be managed as per the protocol. So discharge, this is a criteria for to discharge the patient. That is, the patient has to be afebrile, remain afebrile for 24 hours, and return with good appetite and good urine output. That is 1 ml per kg per hour. A minimum 2 to 3 days he has to stay in the hospital if he has sustained the shock. And platelet count should be more than 50,000 per cubic mm. As I told, the normal count is 1.5 lakh. So this is about the brief introduction to the dengue fever. If you like this video, then kindly subscribe to the channel and press the bell icon. Thank you. Thanks for watching my video.